What I've noticed is that really it comes down to not necessarily, like I said, the symptom list or the diagnostic list, but it comes down to for so many people the beliefs behind their behaviors because
Mm.
beliefs lead to behaviors that lead to patterns, and those patterns lead to physiology, and it absolutely shows up in their labs.
Hey everyone, welcome back to the Pelvic Pulse podcast. I'm very, very, very excited to have this guest with us today. This is Dr. Corina Dunlap. She is a naturopathic doctor, medical researcher, women's health expert, and I can't wait to dive into all the things. I'm so curious, Dr. Corina. Do you go by Dr. Corina or do people just call you Corina?
Uh, Dr. Dunlap, Karina,
Okay.
either way, Dr. Karina, you can call me all of the above.
It's so funny. People always are like, Dr. Brittany, Dr. B. I'm like, yeah, that's cool. I'll take that. Or you can just call me Brittany. It's like my first name's good. Um, I'm so curious how you got into the work that you do because you have a practice, right? That's just robust, it seems like. Yeah, what was your like origin story? I'm so interested to hear. Like why does this work light you up?
Yes. Well, I started out in social sciences. So I started out at a women's college. I went to Smith College. I've always been really passionate about women's empowerment. I used to lead women's rock climbing, guide women's rock climbing courses through Outward Bound and mountaineering courses.
Cool.
And I have always, yeah, just been super passionate about women feeling strong and empowered in general. When I was doing that climbing work and mountaineering work, I realized this is going to be temporary. I can't do this forever. It was very extreme, like 3 weeks in the field, 1 week out.
Wow.
And I started a business in the town that I was based out of, which was Crested Butte, Colorado. And I doing that kind of, it was a mountaineering store. And anyway, raise enough money to travel around the world. When I was traveling, I got very sick and came back to Colorado, um, having gone through what is very commonly just termed traveler's diarrhea or traveler's gas dysbiosis. And I was just not feeling well in my recovery. So I went to see a naturopathic doctor and an Ayurvedic specialist. And
Ooh.
through that work, I was just completely transformed. I worked with that provider for a year, and not only did my gut get better, but some of the things that were underneath the sequelae or the downfall of that traveler's diarrhea that I experienced, I was didn't realize were connected, started to improve as well. I was dealing with an endocrine fallout from that. Basically, I had hair loss, a lot of fatigue. I was feeling really anxious. My not only was my gut not feeling right, but I was having trouble with sleep. I just didn't feel like myself. I had chronic infections, vaginal infections that I thought were
Mm.
just maybe part of aging or I didn't know. And she really just helped me find a healthy new normal and explain why everything kind of had gone awry in the first place. So I was
Mm.
fascinated with the work and decided that I was interested in going back to school. And so I did. I went back to school for all my pre-med prereqs, spent a few years doing all the chemistry, biochemistry, all the sciences that I needed and that any typical med student does. And then I went to my into medical school. So I had my 4 years of medical school. And while I was doing that, for me at that point in my life, feeling extremely motivated, I also wanted to get a research degree. So,
Dang,
natural
girl.
naturopathic medicine is extremely robust in terms of the training for a licensed naturopathic doctor. We get all of the basic sciences plus all those modalities, including pharmacology, but also nutrition, botanical medicine, homeopathy. We get a lot of neuromuscular hands-on work training, IV therapy, so many things.
Mm.
But for me, I also wanted the research. I wanted to know how to read research, how to sort through it. So I did a master's of research as well. And just such a long journey, but really my origin story was I got sick, felt so much better through that holistic care type of care. I had also gone the conventional route with multiple antibiotics before that, but
Okay.
that wasn't the solution for me. And so really the overall healing initial journey really brought me into naturopathic medicine. And then with my real deep passion in women's empowerment, it led me into women's health. So then I trained with women's health mentors, from endocrinology to naturopathic women's health to yeah, general reproductive and menopause trained doctors
Mm.
and MDs, NDs, PAs, MPs. I trained postgraduately with all sorts of different providers. And that type of postgraduate training really set me up for this specialty that I have now.
I love it. I'm obsessed. I was just so I'm glad you mentioned that you also when you first got sick, you ended up going through the antibiotic route too, because I think that was my first question was, did you always know about naturopathic medicine and Ayurvedic culture, like how to heal really holistically? And okay, so it was like a no.
Yeah.
But yeah, I mean, thank you for sharing all of that. And I just so appreciate you following that path of your own passion and like your own interest and really this is it feels like the merger of a lot of the things that you love and I'm so curious now that you're in this specialty like who are you really working with these days like what are your clients or your patients experiencing that it feels like at the surface this is a big deal and maybe they don't realize it yet because I mean, I know for me, like a lot of people are like leaking, that's an issue, or like the vaginal infections, like that can be related to some other things going on in the pelvic floor, of course. But yeah, I'm just so curious if you have that off the top of your head.
Yeah, I mean, because I actually trained in pediatric endocrinology, general endocrinology, reproductive endocrinology, and menopause trained
Wow.
physician. Like, I
Yeah.
worked with the whole span of women from pediatric to postmenopause, and had that postgraduate training was incredible for me. I did it through a residency and then fellowship like trainings with different specialties. So
Yeah.
that was incredible. And then when I started my private practice and now 10 years later, I'm really seeing women post-menarche to postmenopause. It's across the whole span. The main primary demographic that my clinic now supports is really fertility to menopause and beyond. I would say the most common woman kind of scenario that we see is coming into us with they might be later stage wanting to conceive and then or post babies are not necessarily having children, but really into really wanting to get ahead of those transition years. And we've been supporting women in the transition, meaning like the perimenopause transition, which can start late 30s and extend through our 50s. Those transition years, I've been doing that now for a decade plus, thousands of women later, and
Mm,
there's so much to do at that time of care and support. And yeah, this is just it lights me up because I think the most common thing that I see is that women come in and they haven't been given the time of day when it comes to looking deeper into their hormone health.
mm,
So women get they can get support, in terms of like an IVF type practice or even with their gynecologist if they're looking to conceive and they're having trouble or if they're full-blown menopause. But if they're somewhere in between and they don't know what's going on, if they're not looking to conceive and they feel something's off hormonally, or they're maybe not having an irregular cycle yet and they might or may not be perimenopausal, those women are left in the nowhere land, I feel like, in terms
yeah.
of health care. They often are told, we don't need to check your hormones, or we can check a TSH and maybe your estrogen and an FSH, but they don't know. A lot of doctors and a lot of even gynecologists and PCPs might just test very minimal a hormone look, and it's not enough. And then there's not really like a framework or support system to give those women. So that's what I'm super passionate about. And I've built a concierge care practice now that I've had for about 9 years, where it was just me and a nurse for a while. I started this practice and it became extremely popular amongst the women who were reaching out. And
Mm,
I've had a wait list of 6 to 7 months later, and now have a team of doctors and clinicians to support these women that come to see us. So it's really so gratifying, this work, because we see women who have been tried everything. They've been to the specialist and they're not getting enough support.
Yeah, I can see that being a hit among the women because you're so right. That is such a specific woman,
Yeah.
and she is left in the dust,
Yeah.
and often in the pelvic health space too, like in pelvic PT. Um, if she's having like vaginal dryness and like a low libido or um yeah, a lot of other issues, prolapse even after having given birth maybe at some point in her life. And yeah, it's like, no, there's so many things that they could address and do. And I'm so interested to hear if you're able to explain or extrapolate a little bit on like why, okay, I could see why someone who hasn't had the training would be like, no, we don't need to pull your hormones because they're all over the place anyways. Like, why would we take this one snapshot if it's not going to give us a total big picture? But then I'm like, okay, I hear the word framework and I'm like, yes, I could see how you would want to maybe take a look at all these different areas and maybe look at also the woman as a whole and what does her life actually look like. And I'm so curious if there's like specific things you would want if a perimenopausal woman is hearing this, like what
Mm.
should she be paying attention to, or what should she be like asking for if, she can't come see you and she's anywhere in the world or whatever? Is there something you would advise her to look into or ask about?
Yeah. I mean, just paying attention to the little subtle cues that something feels off is the most important thing, because we can have a normal, regular period for quite far into the perimenopausal journey, but really have the beginning effects of the changes and transformation that we're going through. And there's a lot of support that can happen even with a regular period. So you might go to your gynecologist and say, I think I'm in perimenopause, or I'm experiencing irritability or brain fog or difficulty concentrating, difficulty executing tasks. I'm really angry. I'm just not feeling like myself. My libido is down. I might not be sleeping as well. Those are really common things to hear.
Mm.
And she might go into her gynecologist's office or PCP's office and they say, well, is your period irregular? No, it's regular. Okay, well, then I don't think we need to do anything now. But what I want to say is actually, getting some really good, a good look at a comprehensive set of labs is important. I have a lab
Mhm.
guide through my website that I'm happy for you to share with your.
Yes.
It's just free to anyone. These are the most common labs that we test and look for in terms of getting a big endocrine picture at baseline. And this can be done at any stage of life for a woman. Of course, if she's post menopause, some of these might not be, I won't say needed, because it totally depends on if they're on HRT or not. But you can just start with these labs. It gives you the exact timing to look for in terms of when to test. And it's a very comprehensive list, from insulin and blood sugar to thyroid labs to kidney liver function to micronutrients to metabolism, to inflammation markers, detox pathway markers. That big picture is very important. And then just to keep in mind that when you do get, and you can order these labs for yourself. So through the information that I'll have you share with your people,
Hmm.
you can order the labs for yourself and then reorder them later, or reorder the ones that you want to keep a closer eye on. So
Mm.
remember when you get your labs done, it's a snapshot in time, right? We want to look for patterns over time. So this is something where you can get these labs for yourself. You can start to look at some of the details of what's in your results. Of course, if you have somebody who can help sort through and help you evaluate them, it's great. But it includes that lab. Those labs include a lot of the most important hormones to be tested. Now, we have 50 plus hormones in our body. These are our mighty messengers. They dictate everything from how we feel to how we connect with people to how we show up in the world. Hormones influence everything, right from our metabolism to how confident we feel even.
Mm.
And we're not testing all 50 plus hormones, but the ones that are really, really, there's some really key and critical ones to look at that we have in the lab guide for anyone that wants to grab that.
Okay, cool. I know I love that. I love that so much. It's so funny because on the last episode, actually, I had one of my friends who's actually a functional DO,
Yeah.
functional medicine DO. She reviewed some of my labs and just like used my labs as a Like this is what I would look at, da 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 da.
Amazing. Oh, yes.
So insightful and crazy. And I am so excited actually in a couple of weeks I'll be getting my labs redone for the fourth time just to see. And also for context, anyone listening, someone's new. I'm 36. I have a regular period. I am noticing some of these subtle changes. And while I don't think I'm like getting into perimenopause quite yet, it's still like, oh, okay, I'm paying attention. And I've been paying attention to my cycle for a long time. It's been 8 years being off hormonal birth control. And um, the subtle changes that I'm seeing is just that instead of starting first thing in the morning on my period, I'm starting in the afternoons. Randomly, it seems like. Like a day or two early, maybe a day or two late. It's like, okay, we're we're flexing a little bit.
Uh-huh.
But
Uh-huh.
yeah, that's okay by me. I'm okay. But I think like what we were saying before, this group of women who are going through this transition, perimenopause can be a long time. And I've mentioned this on other previous episodes recently, where like my mom had a really it seemed like a very easeful perimenopausal experience. She doesn't remember having any symptoms. And I'm quite literally banking on this fact that this will happen to me too. But I do think it has to do with like our lives, how we live it, our culture and society and all of these things. And I know you recently wrote a book
Yes.
that's coming out so soon. I'm like pre-ordering, pre-ordering, pre-ordering.
Yay.
Um, it's called Hormone Powered, right?
Yes. Hormone
And
power. Hmm.
I love that title, and I actually really love the subtitle, which I think everyone really wants radiant health through their
Yeah.
20s, 30s, 40s, and beyond. Like
Yeah.
that's literally my dream.
Yes.
So I think you named that perfectly.
Thank you.
And also for context for anyone listening, Dr. Dunlap and I, we met in a mixer with a bunch of other amazing, amazing people. And she shared about these archetypes that you've been noticing through the work that you've been doing with your patients over the last 10 plus years, I'm sure. So would you mind describing these archetypes and maybe the listener, you can pick in and see what actually feels like you, or maybe not, or maybe there's a mix of two or three, all three.
Yes.
Do tell, because it was so fascinating when you broke it down. I love a good archetype framework. So,
Yeah. So as a naturopathic doctor, one of the really cool things that we get in our training is to look for deep patterns from doing these in-depth interviews with our patients. And then also as a researcher, I'm trained to look for patterns, right? Patterns and clues and really keep good notes on that. And because my brain has been trained that way now for the last, I feel like 20 years, it's been looking at um, patterns. And I am always thinking about that in practice, and I've now seen thousands of women later. And so I really started to notice these really key behavior patterns have been coming into my clinic. And one of the things that I'm always asking myself when someone sits in front of me and I'm looking for what are the most important hurdles to their health. So I am listening to the symptom list, but the symptom list and even the diagnostic list isn't the most important. What I'm thinking about is what's in between them living the most optimal life now
mm,
and them living the most optimal life they can. And in chemistry, we use this term called the rate limiting step. And the rate limiting step is the step that is takes the most energy, and sometimes in a multi-step reaction takes the most energy, sometimes time and dedication to get through. But once we get through that rate limiting step, everything from there is much easier for that for that chemical reaction to take place. So I'm thinking about that with my patients. What is the rate limiting step or rate limiting steps that we need to get over in order for them to have an easier time in their health and feel really great? And what I've noticed is that really it comes down to not necessarily, like I said, the symptom list or the diagnostic list, but it comes down to, for so many people, the beliefs behind their behaviors, because
mm,
beliefs beliefs lead to behaviors that lead to patterns, and those patterns lead to physiology, and it absolutely shows up in their labs, how the kind of patterns and things they believe. So the three different archetypes that I have found to be very true and predominant in my practice are: number one, the caretaker. This is somebody who feels their worth is tied to how well they care for others. So they tend to put everyone else in front of themselves. So this is very classic for a mom, right? Or sometimes an employee, or might be a child and taking care of one's parents, or a partner taking care of the other person in the relationship. But a caretaker just naturally experiences their worth tied to the care of others. This is really common for people in the medical field to be caretakers. I really associate with that type. Then we have the achiever, and the achiever is somebody who might describe themselves as a type A personality. Their worth is very tied to what they achieve. And the achievement is their sense of safety. So anything that threatens that sense of safety is a second priority to them. And the achiever will almost push at all costs. So they might push and extend the boundaries of what their health and their body really need because of the achievement goals. The survivor is the third type that I've been able to identify, and this person carries a very heavy load. Their safety is actually in staying stuck because it feels safe. So even if it's a
Mm.
dark place, this person might have come in with a more challenging genetic predispositions. Maybe they've had trauma in their past. Maybe they're the foundation of their health and the determinants of their health are very challenging. So, socially or economically, the survivor is somebody who might feel just like I can't do more because where I'm at just feels the safest. It feels safe to stay here, even if it's dark. And for the survivor, we need to really encourage movement or really encourage the momentum of doing something different every day that is moving that snowball effect in the positive direction of their health. So it's often that when I find these different archetypes to be very predominant for somebody, what I'm doing at the beginning is really starting to challenge, what that belief of safety is. And for the
Mm.
caretaker, I really try to have them thinking about their health as a gift for them and those they love. So their affirmation is really taking care of myself and putting myself first. It doesn't mean I'm not taking care of others anymore. It just means I have to put myself first every day, at least for a portion of that day, is going to be helpful for those that I love and not a detriment. For the achiever, we really want to challenge that safety that's tied to everything, that's tied to the drive, and that doesn't build in enough recovery time. And so that can lead to burnout across their adrenals, their thyroid, their gut. And so we really have to encourage an achiever to rest more and allow them to realize that rest allows them to actually do more, not less. You can really reframe it. And rest doesn't mean they're sleeping. Rest doesn't mean they're lazy. Rest means they're nurturing themselves in many ways that allow them to be productive and more
Hmm.
productive if that's the goal, but really also taking care of their physiology. And the survivor, like I said, is carrying that heavy load. So we're really wanting to reframe everything as like my future can be much brighter than where I'm at, or it can be much brighter than my past, building in that little changes, changes in one's health can move and build momentum, and that momentum can build to this bigger um, different future, for them, and really can move the needle in the right direction for them. And the best of their life is yet to come. And for survivors, when they get feeling better, it's like they have this massive perspective. And for them,
Mm.
it's really powerful. So what I see is that these archetypes are often predominant for someone maybe throughout their life. They might have something that they've identified with for a long time, but they can also shift throughout one's life. So I
Mm.
do have an assessment tool. You can take the assessment. You can see on a range of percentage where you land for each
Mm.
of the three. So you can see, oh, I might be, 60% achiever, and then the rest is a balance of the other two. And that can change over time. So the assessment is available to anyone who wants to use that. And then what I do is build, because each of those archetypes has this very specific physiology that plays out for them.
Mm.
For the caretaker, it's often that their nervous system is deeply challenged in terms of they've been exhausting themselves. And the caretaker really, we need to care for that nervous system. We need to care for their adrenal health, their thyroid, their whole the HPA axis, but the HPA-TO axis really with the thyroid and the ovaries combined. And really, and then the gut health comes usually later for them, but is
Mm.
all part of it. And then for the achiever, we focus on the brain because the brain is where things get really suppressed. This often will show up for women who have irregular periods, maybe who have been extreme athletes or not extreme, but they really pushed all the athletic boundaries, or maybe they've pushed themselves so hard that they're very stressed, and that stress has shut their whole HPATO axis down from brain down. So we work on nourishing the brain and reminding the brain that we're safe. So really working on the hypothalamic pituitary axis down to the adrenals, and then it will play out through their thyroid and gut health too. And then for the survivor, they're often very stuck. We have to really open up some of those detox pathways. Often we have to make sure that they're moving. They might tend
Mm.
towards more constipation or sluggishness. They might gravitate towards a diet that might not be entirely helpful for their optimal gut health. We really focus on the movement of gut first, and often for the survivors. All of these archetypes play out in physiology, and I can give you so many examples. In my book, I give examples of how these come into my practice and how we've worked with them with these patients. But in the assessment tool, you can also get a playbook for where you might start if you identify with one of these archetypes, and I break it down from start with these things, based on lifestyle, diet, even from the framework of these are some common tools I use, botanical medicine, amino acids in my practice. These are some labs to run to see what's going on for you. Always, of course, with these kind of frameworks, I want people to work with their providers. This is not medical advice. This is just identifying beliefs that lead to patterns and lead to physiology.
That was a hell of a breakdown. Thank you so much for that.
You're welcome.
I'm okay. So I'm glad that you went into the physiology piece because I was going to ask that if there, I know you were saying that the symptoms and diagnostics didn't really like that wasn't what you were paying attention to at the most, but I could have seen how exactly you listed these particular archetypes had certain like symptoms and or it played out specifically in their physiology what they were experiencing and maybe instead of going yeah into all the examples that you list in the book,
Yeah.
I'm curious for you. You said that you identified most with like the caretaker,
Mhm.
and I'm wondering if like looking back at this original experience working with a naturopathic doctor, like
Mhm.
having traveler's diarrhea, just like upset, tummy and all of that. And
Mhm.
you said there were sequela and other things that were happening downstream, right? What was, you think, like the rate limiting step in your own experience? Was there one? And or like for your caretaker archetype, like was there anything coming up for you in the more recent years that, after having worked in the practice for a decade, like anything coming up in your physiology that you had to remind yourself too about some of these things? Before we get back to this conversation, I want to invite you into something brand new in the Being Better world. Alchemy August. Starting today and all month long throughout August, I'm sharing more about vaginal alchemy, a self paced journey for coming home to your pelvic bowl, your pleasure, your sensuality, and your body's wisdom. The doors are now open and you can join for $497 paid in full or 5 monthly payments of $111. When you sign up, you'll receive a vaginal alchemy intake form designed to offer guidance based on where you are right now. And for the first 10 women who decide to join, I'll personally create a customized vaginal alchemy map based on your intake, a bonus at no additional cost. If you've been feeling called to deepen your relationship with your body, your healing, your pleasure, this is your invitation. Head to the show notes to learn more and sign up for Vaginal Alchemy today. And now back to the episode.
Yeah, Kate, I would say, so for me, my top two are really caretaker and achiever.
Mm,
Those I don't know what I may have been more of an achiever when I first started and before going into naturopathic medical school.
mm,
Now more of a caretaker is what I resonate with because it's the stage of life that I'm into with two kids, and I'm a
mm,
doctor, and I care for a lot of patients, and I care for my team and my family and everything. So, but yeah, with both of the caretaker and achiever, you have to watch out for those extremes where either you're not caring enough for yourself or putting yourself first enough in terms of health factors. Sometimes
Mm.
achievers, though, they almost have too much of a bullet point list that they need to check off, and that can even extend into the health realm. Like they
Oh
almost need
yeah.
to, like, we need to say, like, okay, you don't need to exercise every single day with 2 hours of really hardcore training. We need to actually have you do more yoga, restorative, or we'll just walk, or that's like that's a good achiever shift. For me, it was really about pushing I would identify with being a workaholic, as at that stage of
Mm.
life. Like even living in a ski town, I worked from the beginning of the day to the very end of the day. I've always been very driven, even to the extent where I had, needed to complete 2 degrees, my naturopathic doctorate, which is normally a 4-year degree, and a master's of research, which is normally a 3-year degree.
Dang, girl.
I had
Yeah.
needed to do that all at once and combine the two. So yeah, that for me early on though, that played out in setting me up for this gut disruption, which I
Mm.
think, I went through the early state, what was further upstream, which was adrenal burnout, that affected my thyroid. My thyroid and adrenals were already not well being cared for. So I was experiencing what was further downstream. So when I did get traveler's diarrhea, and I had parasite or, the multiple things that I was dealing with gut wise, my approach to getting better needed to be nurturing the nervous system and adrenals and the thyroid that had been not supported to begin with in order to really feel better. And that is what I did. I had a lot of botanicals that were given to me. I had to relook at how I ate and
Mm.
really prioritize extremely well-rounded meals and not just like quick, fast and fuel, but really like I had to relook at the diet, lifestyle, how I was exercising, how I was sleeping. My sleep was being really shortened, and
Mm.
and then that really helped me. But I really, I learned so much. I've learned so much through looking at my behavior first. Now I know as a caretaker it really makes a huge difference to my family, my friends, my patients, my team, if I can attend to myself every single day, somehow, some way. So, for me, it can be just simple things like walking, make sure I'm getting my meals on time. Going to bed early, even if I have a long list of things to still do, I know I'm going to be more effective and more helpful to people around me if I get that critical sleep.
Mm.
And these are things obviously that can apply to all people, but what I think when you see it through the framework of the archetype, it just helps you zone in on like the key piece. Like for me, it's like, yes, my kids do need me and I need to be places on time and I have to attend to those things, but building in this care for myself is critical. And I can't forget that. I can't put everybody else ahead of me. So that is a really important piece.
Yeah, I was actually just going to ask you, like, history wise in the timeline of your life and like the learnings that you did, like when you, I could almost see this experience of traveling and getting sick and figuring out some of these beliefs and behaviors that probably set you up really beautifully for motherhood. And this is a favorite topic for everyone that listens. Like I love it personally too. I just find it so inspiring also to talk to women who have gone through a lot of um like health discoveries. I wouldn't even want to call them like health issues because sometimes they don't stay issues. They just are brand new discoveries that you carry on in the rest of your life. And I could see that setting you up for a beautiful experience in motherhood, even though it may still be hard and challenging in all the normal ways. But
Yeah.
I'm curious how that journey was and like where in the timeline did that happen for you? And um yeah, it's like also you have this other baby coming through, which is a book.
So true. Oh my gosh. Thank you for saying that out loud because that's how I feel too.
Yes. Yes, a whole different kind of birth, I'm sure.
Yes. Yes. So motherhood. Oh my gosh. Yes. All of this has been such a huge journey. I'd like to back up though and just really say this is really important to me. I want people to understand that even while we're talking about archetypes and behavior leads to patterns and patterns lead to physiology, I am never ignoring medical diagnoses or labs, or those are all always part of the assessment. I'm a very evidence-based provider. So is my team. That we take that all very seriously. There's just an added layer, to our approach, and that's really nice for people, and it's very nurturing, and it really does help people make the transformations that they make. But back to the motherhood piece and also the journey of being in health and constantly working on your health. It's not like I have one origin story that got me into naturopathic medicine, but there's multiple things that have happened since then, right? Um, Getting pregnant was at the end of medical school, at the end of my 30s, and 38 and 40 is when I had my two girls. Um, that was really challenging. I went through really, like I said, did a lot of achiever type, approach to going through those degrees, and that wasn't great for fertility or getting pregnant necessarily, and it was challenging, and also it can be more challenging, right? Naturally, um, as we get older, and it really allowed me to go deeply into the fertility aspects of women's health and men's health too. The sperm and egg are equally involved,
Takes
and
two.
yeah, and truly I really like just that approach, like really working on preconception health, working through a miscarriage that I had, experiencing that now built so much more empathy into my practice for what patients sometimes go through. And a
Mm.
lot of times that's out of our control. Sometimes there are things we can do. I learned a lot about, our thyroid, how to nourish our bodies, how to care for that endocrine system, how to care for egg quality as much as possible, sperm quality. So all of that has been a journey there. And then on the other end, really feeling so grateful to have these two kiddos that I was able to have in the later stage of my reproductive life.
Mm.
And then having my youngest at 40, breastfeeding her until 42, and then really I was right in the like heart of perimenopause journey for myself too. And then
Mm.
building my practice that I have now at that time, took so much. And if I could go back and do it all over again, I would be working much more closely on that, getting my labs, checking my labs, making sure I know exactly where I'm at in the perimenopausal journey, because I would have started with that support, the perimenopause support. Ironically, it's the population I've been serving this whole time,
Mm.
but I would have done it for myself so much sooner had I realized you're not just postpartum, you're actually in perimenopause, and that's more of where these symptoms are coming from.
What were
So,
you experiencing symptom
well,
wise?
yeah. So for women who have gone through postpartum will know, like, you get this huge drop in your hormones, right? Your progesterone, your estrogen kind of fall off a cliff. Your prolactin goes up. It suppresses the ovulation. That's can come back and come back slowly as you um, get out of the cycle of fatigue really and rebuild. But for me, definitely like dark thoughts, anxiety, difficulty concentrating, and I'm right in the heart of my residency during this time. So the challenges of that, feeling like I have worked so hard for this, and the self-esteem challenge that came with that. So I
Mm.
felt like I had to overcompensate in so many ways, bringing my daughter everywhere, to all the
Mm.
meetings, to all the things where, looking back, I wish I would have just realized like this is more than the postpartum journey, and there are other tools available for you if you are in a perimenopausal journey coming out of having kiddos later in life, and a lot of women are there.
Yeah, a lot of women are there. I mean, I know there's probably so much that you share on your social media. I think that's such a, wealth of knowledge just sitting there for free. Like, please go access this and look at this because I feel like the amount of time you probably spend on that is just to be able to help and reach other people. But like, what would you say if someone was in that postpartum journey and they were just on the brink or they're in perimenopause while being postpartum, like what would you say are some of the top things that you'd ask them to take a look at or
Mhm.
just make sure that they're
Yeah.
not checking off the list, but. you know.
Yeah. Just attending to.
Yes.
First, remember you still have to prioritize yourself, even when it's hard and you have kids to tend to who are little, and getting those labs checked just to know, okay, here's where my micronutrients are. You know, we're very depleted when we come out of birth and
Mhm.
growing humans. So making sure that you're replenishing all those micronutrients. A lot of women will take their prenatal through their pregnancy and then stop because they're, once the baby comes, but they're if they're nursing, and even if they're not, they are still very depleted, and often there are higher demands for them micronutrient wise. So making sure those are tested and replenished. Secondarily, and not secondarily, because this is really primary too,
Yeah.
is understanding what the hormone picture is and landscape for them at that moment. So yes, naturally we'll have lower estrogen, progesterone, we might not be ovulating, or our cycles might be coming back on board. But if they're not, and if they are really, really delayed, understanding why they are is extremely important, because there's support that can be given. From a vaginal and pelvic health perspective, oh my goodness, I know you could say so much about this. I can too, but I trained with Tammy Kent when I was
Mm,
doing my residency, and
love.
late in my training. She's amazing, so amazing. And I went to her as a patient, actually a client, after my second baby, and I had had some deep tears, some repair work done, but it wasn't enough to keep the strength of my pelvic muscles. And so while I was doing this work on other women and learning how to do it, I really was like fascinated to experience it myself. But for women who have gone through this journey, who are in their late 30s and 40s, talking to your doctor about what kind of not only um, physical therapy can be done, pelvic health is so critical and so important, but also what kind of vaginal supports for not only the microbiome but also for your hormones. Like we can start as women on vaginal estrogen very safely for for the rest of our lives. Most women and every woman, in my opinion, should be on vaginal estrogen. It's not like a systemic, I'm not talking about systemic estrogen. I'm talking
Mhm,
about localized estrogen
mhm,
support. It's incredibly protective to those tissues. We lose a lot um, of estrogen vaginally in the pelvic area very quickly, and postpartum, where it can create a lot of pain, tearing, difficulty healing, difficulty with the microbiome, and I'm happy to go into detail about that. But I think I definitely would have started that earlier for myself.
mhm.
And I'm glad to be doing it now. And I am a huge advocate of women getting that kind of support. A lot more women do get that kind of support now, which I'm so grateful for, but I still don't think it starts soon enough, quite honestly.
Mm.
And it's
When
so safe, so safe.
when would you want them to start it? Because I am very curious about this aspect
Yeah.
of hormone replacement therapy. I'm curious because I see both camps.
Hmm.
And I listen and I'm not there yet.
Yeah.
I don't
Yeah.
think
Yeah.
so. And I just find it so fascinating the thought process for each side. And I don't swing one way or another necessarily. I play very Switzerland neutral at this point because honestly, that's what I want for women is just to feel as empowered and best in their body as possible. And if this helps or this doesn't help and this makes you feel a certain way, then okay, like who am I to say, you know? Um,
Yeah.
but yeah, I'm very curious about, I was just telling a group of women yesterday, like when you go through, uh, and are on the other side of menopause, it's like your inner labia go away. And
Yeah.
I've seen a postmenopausal vulva. I've seen, many, and they don't look like mine now,
Yeah. Yeah.
And it's fascinating to me. And I'm actually curious. I don't think I've ever asked this before, and I've never looked it up myself. But if you were on vaginal estrogen, does that help maintain the inner labia for a
Yeah.
longer period of time? Okay,
Definitely.
that's what,
Oh, yeah.
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 Because the reason they disappear is because of your lack of estrogen, right?
Yes, exactly. So everything thins. There's more atrophy, obviously, as estrogen leaves the vaginal vault, and the internal, external anatomy,
Mm.
and we are more prone to infection, both vaginal infections as well as UTIs, as the opening of the urethra, as it atrophies, it becomes more prone to infection. We actually have less of a vertical angle to the the urethra, and it actually becomes more horizontal. So
Mm,
infections can ascend more easily without that estrogen support. So the estrogen helps keep a lot of the connective tissue in good standing, as well as the flora in good standing. We have more lactobacillus that's very protective. Um, our pH will change as estrogen declines, so we're going to be more prone to infections like BV or bacterial vaginosis. Often when we'll talk about like the kind of amine odor or the odor that can be created by the BV,
mhm,
and that's often due to a change in that flora and the increased pH. And so estrogen is extremely neutralizing to the pelvic flora and supportive of keeping us from getting infections. So when we're postpartum, we're very estrogen deficient down there. And then, of course, as we move through perimenopause, we are, and postmenopause, of course. So it's almost like I think of it as nutritive to the vaginal vault and the
mm,
pelvic floor. And I even see it play into the anal opening too.
mm.
There's some support there that can be translated to the entire perineum to that anal opening just by using vaginal estrogen. I really, really am a huge advocate for it because it's so safe. And I'm not it's a slightly different conversation than HRT. When we talk about HRT, we're really talking about systemic
Mhm.
use of hormone therapy in higher doses. When we're talking about vaginal estrogen, yes, it's a type of replacement therapy, but it's very localized. We use this extremely safely for women who, of all different histories, we can use vaginal estrogen for women who have gone through breast cancer and who have hormone sensitive tissue in their body. So we can use this very safely. And of course, you have to work with your provider, and there are other ways to keep that tissue lubricated and hydrated, but nothing's really replacing estrogen once it's
Mhm.
gone for that tissue. So I'm very huge advocate of vaginal estrogen. And I'll talk about it very freely like that, even though I don't like to give generalized recommendations.
Of course.
The one that I will say for women is most women should have at least the conversation with her provider that she trusts about when is the right time and if it's right for her, and to be offered the option to try it.
Hmm, hmm. I appreciate that. And when, yeah, you were saying safe, like this is a safe thing, I was assuming it was for people who have a history of cancer, breast cancer, ovarian, all the things. So I appreciate that outlook too. And I am wondering as well, like if there are other things that you would recommend if someone didn't want to be on it any longer or they didn't want to start on it, like for whatever reason. Um, do you have any other offers like for a woman who doesn't want to feel the atrophy? And I will say from a pelvic PT perspective, there are ways to remain strong and feel resilient and feel lubricated for sure. And I mean, it's not a if you don't use it, you lose it kind of
Yeah,
situation. I don't want to like say that per se, but you definitely have to tend to your tissues.
yeah,
Like it's like
exactly.
skincare down there. It
Yeah.
it really matters.
I love it when you say it like that. It's so true. Yeah. I mean, there are a lot of ways to do it. I think definitely the hydration piece is important. The flora is really important, keeping and tending to a really healthy diet, healthy GI that translates to your vaginal flora. So that is really important. We can use things like systemic omegas. Omegas are
Mm,
very hydrating to the tissue in general. That's lovely. Keeping our gut microbiome in a really good spot will also translate to the vaginal microbiome. So doing really great support for prebiotic, probiotic, postbiotic kind of care, making sure that we do have healthy bowel movements and that we're not constipated, because if we get irritated down there from being constipated, that can translate to vaginal and pelvic difficulties as well. Making sure to practice all the good hygiene, post any sort of um, sex, of course, like making sure everything is you're doing all the practices that help keep us from being prone to UTIs. Um, Making sure we're not like using too many products down there that are irritating to the
mhm,
tissue. And then like the types of things that can be so nice and nurturing that aren't hormone related. There are great options. Vitamin E oil can be really easy. Even like coconut oil for women can be really easy. Um, and like I said, doing the things internally to keep our skin healthy too. that we do. Like, I mean, I love collagen in general. I do love collagen.
Mm.
I'm an advocate of it. I've done tons of research on how it does change our skin in general. So
Cool.
that I think really affects us everywhere. But yeah, there are a lot of ways to care for our vaginal tissues and our pelvic health. And then of course, exercises, right? Very targeted to the pelvis. The more that we're using that tissue and we're engaging the muscles down there, the more blood flow we have, and the more strength it builds. Healthy circulation is fantastic. So all of those things.
Agreed, agreed. I love that. Thanks for the abundance of options and reminders too. Like it starts from the inside for sure. So I really do appreciate that. Okay, final question. I'm curious if there is one thing that you are sharing, especially with I think about your daughters now, and if there's one thing you want young girls to know, want these women to know, is there anything left unsaid that you haven't yet shared that you really just want to like leave the woman with?
Mhm. We we can get gaslit in so many different ways as women. And I think for all women, I just want you to believe in your body. Believe in your body, number one, that has the desire and potential to heal and feel optimal. The goal really is to extend this health span for our lifespan. So, what our lifespan is going to be, if it's going to be nice and long, we want that health span to be equal to that, right? We want to feel amazing up until the end. I mean, that's the goal. And in order to do that, we have to listen to ourselves and trust our bodies are giving us the signals that need tending to. So when you go in to see somebody, if you feel dismissed, which is just way too common even today, which is just shocking to me how much that happens, to trust yourself enough to say this is not right, and I still have to find an answer, and keep searching for your answers and trust yourself. If something feels off, it's likely is. We might not have that specific lab to show it, but working with people who are really listening and helping really help you find the best path forward for you. And usually it's going to be in daily habits of living, um, little things that add up to this exponential interest effect that I like to think about, snowball effect, moving in the right direction for you, for your health. But just keep listening and practice your daily habits of health, and it will really benefit you in the long run.
Thank you. Thank you so much, Dr. Corina Dunlap. I'm so glad you were here. I will link everything in the show notes. Please, listener, go check out her assessment tool. Go pre-order her book. I can't wait to dive into this. I think I'm gonna get it and it's gonna arrive right before we leave for our honeymoon. So I'm so stoked to be able to take a hard copy with me to travel.
Thank you. Oh my goodness.
Yes, yes. No, I
Yes.
can't wait. I'm so excited for you. And again, thank you so much for being here.
Thank you. Yes, and anyone who does pre-order the book, and even after it comes out, we'll still have these bonuses available, but please go pre-order the book because it just does help so much. There are bonuses available. We have the playlists for each hormone type. So those
Oh,
archetypes playlists available, and a master class with each type that I will be giving and delivering directly to you.
wow. Oh, I love that so much. That's so cool. So cool. I can't wait. Thanks everyone for being here. We'll see you next time. Thanks for listening and for placing your finger on the pelvic pulse. I'm Brittany Ellers. The music for this podcast was created by Just Tech, and I'm grateful you're here breathing this conversation in with me. You're invited to stay connected by following the show on Apple, Spotify, YouTube, or wherever you listen, and by sharing it with someone you love. Beyond the podcast, there are 2 free spaces waiting for you: the Arousal Anatomy Adventure and my private podcast, The Pool of Presence, both designed to support you in coming back into your body and listening to what's real right now. You'll find everything linked in the show notes. Let your curiosity lead you and enter wherever you feel drawn. It's an honor to walk alongside you.